Hi, everyone. Welcome to the Maternal Health Education Project. I'm Madeline, and I'm specifically focusing on finance and resources. I'm here with Amanda Clasman, and I'm going to let her introduce herself.
Hi, my name is Amanda Clasman. I currently am the customer service representative for CNS Healthcare, but I also have some personal knowledge with maternal health, and so I thought I'd be a great addition to come on here and just kind of talk about mental health and how you can get those services and why they're important for maternal health as well.
So, going off of that, what exactly is CNS Healthcare, and then what services and programs does the clinic provide?
Okay, so CNS Healthcare is a mental health agency. So we provide behavioral health services such as targeted case management, substance use programs. We offer children's services as well, so that helps with like a whole family aspect. So therapy in various forms. We have specialized therapy such as behavioral therapy. It's DBT, dialect behavioral therapy, and what it and that's just a really interesting program that we have that has received a lot of positive feedback. And we also have employment services and community resource connections. We offer crisis services, and we have clubhouses and drop-in centers for our the people that we serve. So a range of services.
So where is CNS located, and like, are there locations outside of Michigan, or just like where in Michigan?
Okay, so we aren't unfortunately outside of Michigan yet, but I will tell you we've had over 25 years of experience serving in Oakland County, and within the past 2 years, we've been able to expand out into Wayne County, which is great for accessibility and where there is a great need. But even more recently, we're merging with another company, which is great news because then we'll be able to be accessible for people in Macomb County as well as the east side of Detroit. So really trying to just be accessible and have these locations everywhere is kind of our goal. So who knows, in the near future, there might be some outside Michigan as well.
Going off of that, I know that Michigan is on a new grant program, which is the Certified Community Behavioral Health Clinics. Do you know how people can find clinics functioning under these grants, or if it's just like specific to certain areas or clinics?
Okay, so that is one of the wonderful aspects about CNS as well, is that because we're operating under this grant, you don't necessarily have to live in those counties that I just named, Oakland, Wayne, Macomb, to get services from us. Because we're able to just serve CCBHC is generally those who are uninsured, underinsured, or underserved. So that meaning like they don't have insurance or they have insurance, it just doesn't cover like the range that it needs to, like doesn't cover mental health services, or those who are underserved, meaning they're not getting access to services where they are, and so they need to come, that's medically necessary, and so they need to come to us to get those services. This is all based off of medical necessity, so there are assessments and stuff that go into it, but again, you're getting these wonderful services and range of services. And so there's lots of clinics that are also funded by this grant, and you can find a comprehensive list of them on the substance abuse and mental health, what SAMHSA is what it's called, is SAMHSA. And they on there, they have a whole concept of every clinic that is being funded this. Now, every clinic obviously offers different services and stuff like that. So it's great if you don't have insurance and you need to go see a doctor, and you can find a clinic on there for that. And then if you need mental health services, you can go find a clinic on there that are going to meet those services that you need. So
That's really great to know about the website. We'll definitely have that link down below for people who want to know about that and learn more. And it's also great that you compared, like, you might have insurance, but not all insurances are so encompassing where they don't cover mental health and you can have the bare minimum insurance. So, because people might think, like, oh, I have insurance, I'm not going to qualify, but that might not be necessarily true for everyone. And then, how have your services adapted to the challenges posed by the ongoing pandemic?
yeah. So that was, it was interesting at first because our services are mainly community based. We go out, we see you. And obviously, there was a great limit on that when all this started. So the state of Michigan worked with us a lot. And so they've allowed telehealth to be accepted for targeted case management, for therapy services, and for the clinic services that we provide to make sure they want to make sure that people are taking their medication if they need, and aren't seeking. I mean, all this isolation is causing, more mental health issues within people, depression, all that. So I applaud the state of Michigan and how fast they acted in changing some of those, mandates that they had to allow telehealth medicine to continue. It's not everyone's favorite kind of, therapy or whatever, but we'll get through this and then we'll be able to do face-to-face therapy again. But hopefully the state of Michigan will still consider allowing telehealth for those that don't have transportation and have those barriers. So that's something that I think we'll definitely advocate for as CNS, because we've seen a great improvement, even though, we're all locked down and everyone's, we've seen an improvement in people, attending their appointments and stuff like that. We've also, just to brag on my company a little bit, we used a lot of the CCBHC funds to supply tablets and cell phones to people who have been coming to us for services but didn't have access to those things. So that was, we really want accessibility. People, if you feel like you need to talk to someone, we're here. We can talk to you. So that was really cool in my company.
Yeah, that's really amazing. And I never thought about, like, yeah, it might not be everyone's favorite to be virtual, but also, yeah, for people who don't have transportation, that's extremely helpful and would be, like, great to continue. And I'm excited to see how, like, after the pandemic, how things that we've, like, adapted to, that we were incorporating, that we had to change to, and we didn't want to at first. So then with that, so I know, like, now people can get remote services. How can people reach out to CNS for help? Is there, like, a process to verify if they qualify, they need certain documents and such like that?
Okay. Yep. That is a wonderful question. I really like this question because even though we've been talking all about the CCBHC grant, ultimately it's not encompassing. Like, if you come to us for mental health services, we'll be able to serve you. But if we need to refer you to a doctor or a specialist or something, you don't have, a lot of people don't have, are uninsured, so they don't have any insurance at all. So what we like to do and what we do, we reach out to the county in which the person lives, if they're one of Oakland, Wayne, or Macomb, and then we'll be able to get them Medicaid and link them up with the Department of Health and Human Services, because ultimately that's going to be, you're going to get the best out of all your services and your overall health with having, some form of insurance. CCBHC is definitely there as a support or a backup for, those who don't qualify for Medicaid, and all that. Intake would be, okay, so we have these, we have an intake department, a whole department that you come to, and they'll screen you and determine if you would qualify for Medicaid or if we should just open you up with CCBHC and go that route. So the information that you would need is definitely, if you have any insurance, bring kind of that information with you. The appointment does take a while, so it's about an hour-long appointment, which is, frustrating to some. But we have to kind of assess kind of where your needs are and if it's medically necessary. So there's a number that you call to start that whole process, and I have supplied it to you, but I'll also say it during this. It is 877-211-8611. And that is, again, to reach our intake department. And they are wonderful. They'll just kind of guide you through, and if you should need to go back. Detroit, Wayne, each county has their own rules. Detroit, Wayne, you have to go through their access center before. So if we get you and we're like, oh, you qualify for Medicaid, we're going to have to send you to access, and then you can tell access that, I'm interested in CNS, and then we can then open your case with us through that way. Again, Medicaid being the best route because you'll be covered, but some people are like, but I called you and I don't want to have to call them. It's the way the process is, unfortunately. But after all that happens, you'll get open with us, and services will just start rolling, and there shouldn't be any issue. So that's our intake number, and they're really great with just guiding you and what you should do next. And really the only information you need to have is, your name, your birth date, stuff on your driver's license, and your insurance information if you have any.
Thank you. That's really helpful. I think you touched on this a little bit, but can women get resources for their children through CNS?
So definitely, we link with so many different resources in our local communities. So if you're a woman and you're coming to us for services and you have children, local churches we connect with. So whether it's clothing or food services, we also connect with DHS. We in fact have an in-house liaison for the Department of Health and Human Services, and really her job is to make sure that everyone that's with us at CNS, their Medicaid and stuff stays active and consistent. So if you have any questions with the forms or anything that DHS sends you, she helps you out with that. Through that, the Department of Health and Human Services has the WIC program, which is Women, Infant, and Children program, which is a wonderful program. Just having those connections tends to get people in those programs faster and stay organized and really be able to get the most out of those programs. So we link with all these different community resources, whether it's clothing, food, medic insurance, and WIC information and help and support and getting all those services. We also offer family therapy and children's services. So as a parent, if you're having any issues behaviorally with your child, we would be a wonderful resource for you.
Oh, that's awesome. So then I guess going off of that, you mentioned WIC, but how can services provided by the clinic aid pregnant women or new mothers?
Okay, this is a really sad statistic, but like 15% of women suffer from postpartum, and there's stress and so much change that goes along with becoming a new mother that you may just need to talk to somebody about it, and that's okay. There's nothing wrong with that. Your whole life is changing, and there's scientific proof of just how postpartum can change your life and have impact on development with your child, and making that bond between you two, which is crucial to depression is very prevalent in our society, and even higher, I think, in women. So we have these services, so you can come and talk to us about them. If medication is the route that you choose, we can assist you with that as well.
Thank you. So then for not just new mothers, but do mothers under the age of 18 qualify? I know sometimes there can be things with like they still have legal guardians if you're under 18. Do you know anything about how that works?
Yes, I do. So I was able to look up, we have, in Michigan, we have a mental health code, And in that, Michigan Legislative Section 3301707 states that a minor 14 years of age or older may request and receive mental health services, and a mental health professional may provide mental health services on an outpatient basis, excluding pregnancy termination, referral of services, or use of psychotropic drugs without the consent. So, except for those three things, you can come to us and we can talk, and your guardian, in the state of Michigan, your guardian does not need to know or be informed. That is your right as a human that may need therapy services. And I, again, applaud Michigan for looking out, because sometimes people don't have the best situation at home and may not want to tell their parents that they need therapy or something like that. But exclude from those three instances, we can offer services without the consent of a guardian.
So then CNS has services that are both community-based and individual. How can mothers benefit from the community services along with the individual?
Well, I definitely have mentioned this previously in this interview, but our community resource connections are huge. So, mothers definitely benefit from when they're able to interact with their community. So we not only offer these services in-house, but I've talked about how we have the clubhouse, we have employment services. So we can, get you involved in the community, or there's also social events and stuff that we have. We have like a Christmas party, a summer picnic every year. We have an exercise group. They're not services, but it's definitely still including the mother. And isolation is definitely something you don't want a mother to feel. So I think those are important. And sometimes the employment services is another amazing thing that we do, and we have a high rate of placing jobs. So we have connections with like Buffalo Wild Wings in the community and stuff like that. And sometimes it's just good for a mother to get like a part-time job and get out of the house and really start to feel some normalcy in life again, if that's what interests them. So.
Thank you. So I guess going off the community, what is a community needs assessment, and then why is it important, and what does the clinic do with this information then?
Okay, so a community needs assessment is definitely important. It really shows different levels of poverty. It even specifies insurance in certain populated areas, and showing where there's a lack of need. That's kind of what the whole assessment is about. It's just finding where the lack of need is. And we've taken that information. That's a lot of why we've expanded into Detroit, trying to reach those people and the need there. We're the only agency in Metro Detroit that offers transportation to and from our clinics for mental health services. So we saw that as something that needed to happen in Detroit. There's a large transportation barrier there, and so we took the assessments and the needs there and really found a specific location, which is right off of Joy Road, that we felt was going to be really integral. There's bus stops right nearby. There's also shopping plazas right nearby, so people can come to us and not have to go too far to go do some shopping and then get back on the bus and do all that. So it really helps put things into perspective and really find where the need is, and then act on it. And CNS definitely has done that and will continue to do that.
So, well, thank you so much.